Restless leg syndrome symptoms and natural treatments. Restless legs syndrome is a condition that causes a strong desire to move one's legs. Willis-Ekbom disease is another name for it. It affects more women than men in the general population and can be a common issue for people with Parkinson's. Symptoms can appear at any age, but they become more common as you get older. Restless legs syndrome can be classified as mild, moderate, severe, or very severe based on the severity of the symptoms, how frequently the person experiences them, and whether or not they interfere with daily activities. The majority of people's symptoms are not severe or frequent enough to necessitate medical attention. When it occurs varies from person to person. Some people have it on occasion, while others have it on a daily basis. It usually happens when you're resting, such as when you're sitting in front of the TV or lying in bed. RLS patients experience periodic limb movements in their sleep in 80 to 90% of cases. RLS affects 2 to 5% of the population. It becomes more likely as you get older, and it is more serious in the elderly. However, it can begin at any age. It has been linked to pregnancy as well. Restless legs syndrome affects approximately 10% of adults in the United States. According to researchers, RLS is frequently misdiagnosed as insomnia or another neurological, muscular, or orthopedic condition. Symptoms. Not only do the signs and symptoms of restless legs syndrome vary from person to person, but they can also be difficult to explain. Some people describe the sensations in the legs as creeping, prickling, burning, tingling, or tugging. Others claim to have bugs crawling up the legs, or a deep bone itch. RLS symptoms can range from mildly annoying to severely incapacitating. You may only notice the symptoms occasionally, such as when you're under a lot of stress, or they may bother you every night. Here are some signs and symptoms of RLS. Leg discomfort and strong urge to move. Deeply unpleasant sensations in the legs, accompanied by a strong, often irresistible urge to move them. Tingling, jitters, a creepy crawly sensation, itching, or pulling are common descriptions. Rest triggers the symptoms. Leg pain is normally triggered by activity and relieved by rest, but this is not the case with restless legs syndrome. When you sit, relax, or try to sleep, your restless leg symptoms begin or worsen. Symptoms get worse at night. RLS usually worsens at night, especially when you're sleeping. In more severe cases, symptoms may appear earlier in the day, but they become much more severe at bedtime. Symptoms improve when you walk or move your legs. When you move, stretch, or massage your legs, the unpleasant sensations subside for a short time. The relief will last only as long as you keep moving. Nighttime leg twitching. Many people who have restless legs syndrome also have periodic limb movement disorder, a sleep disorder characterized by repetitive cramping or jerking of the legs while sleeping. These leg movements disrupt your sleep even more. Here are some alternative treatments. Vitamin B1 Thiamine. This vitamin assists the nervous tissue to perform correctly and reduces incidence of symptoms. But vitamin B1 may be more useful for reducing symptoms in combination with the rest of the B vitamins. Vitamin B5 Pantothenic acid. This vitamin helps the nervous system tissues perform properly and reduces incidence of symptoms. Vitamin B5 may be more useful for reducing symptoms in combination with the rest of the B vitamins. Vitamin B12 Cyanocobalamin. This vitamin is very important to help reduce symptoms. A deficiency of vitamin B12 is known to cause secondary restless legs syndrome. Vitamin C. Because vitamin C helps to strengthen the capillary and other blood vessel walls, it may benefit people who have peripheral neuropathy symptoms as the underlying cause of restless legs syndrome. Vitamin E. The antioxidant vitamin E may help reduce symptoms in people with peripheral neuropathy, as it helps to ensure there is proper circulation in the legs and arms, and that the blood in the veins and arteries is circulating properly. Calcium. Calcium is necessary to enable proper muscle contraction and to ensure the muscles work effectively, so it may assist with reduction of symptoms, but mainly in conjunction with other nutrients. Potassium. Potassium is also necessary for proper muscles contraction and ensuring the muscles work properly, so may assist with reduction of symptoms, also in conjunction with the other nutrients. Iron supplements. Iron supplements may help people with restless legs syndrome who are iron deficient. Patients should only use them if dietary measures have failed. Iron supplements do not appear to be beneficial for RLS patients with iron levels that are normal or above normal. Magnesium mineral supplement. Observations have shown that oral magnesium therapy may ameliorate symptoms in patients with moderate RLS. 5-HTP. If the iron levels are normal, then 5-HTP supplementation may significantly improve, or even eliminate, restless legs and myoclonus. Folic acid. If there is a family history of restless legs syndrome, high-dosage folic acid, 35 to 60 mg daily, therapy can be helpful. Chamomile. Studies show the herb chamomile has mild calmative effects. It has a calming effect on the whole body, which can help with RLS. Ginkgo biloba. The herb Ginkgo biloba has been used in Chinese medicine for centuries. It has beneficial effects on peripheral circulation and may help to improve symptoms. Valerian. Studies show that the herb valerian is effective in inducing sleep, as it has sedative effects. Valerian is often used in herbal preparations for insomnia. Essential fatty acids. The body requires omega-3 essential fatty acids to help reduce inflammation, particularly in the muscles, tendons, and nerves. The essential fatty acids may be particularly beneficial in reducing the severity of symptoms. Gaba. Gaba, an amino acid, is also one of the neurotransmitters that help the body relax. Gaba is also required for the production of dopamine, another important neurotransmitter that may not be functioning properly in people with restless legs syndrome. Tryptophan. There is a link between low levels of the amino acid tryptophan and increased incidence of restless legs syndrome. This is most likely because tryptophan and vitamin B3 are closely related. Vitamin B3 can help to relieve restless legs syndrome symptoms. RLS also appears to be related to the following factors and underlying conditions: end-stage renal disease and hemodialysis, iron deficiency, certain medications that may aggravate RLS symptoms, such as anti-nausea drugs, antipsychotic drugs, antidepressants that increase serotonin, and some cold and allergy medications that contain older antihistamines, use of alcohol, nicotine, and caffeine. Pregnancy, especially in the last trimester. In most cases, symptoms usually disappear within 4 weeks after delivery. And neuropathy, nerve damage. Sleep deprivation and other sleep conditions like sleep apnea may also aggravate or trigger symptoms in some people. Reducing or completely eliminating these factors may relieve symptoms.
Do not stop taking any prescribed medications or treatments without consulting your doctor. The materials and the information contained on this channel are provided for general and educational purposes only and do not constitute any legal, medical or other professional advice on any subject matter.